Scope of the problem. Drug misuse continues to be a major public health concern worldwide, impacting individuals of all ages. Psychedelics are being researched as potential treatments for mental health conditions like PTSD, depression, and anxiety. However, many areas lack adequate mental health resources which increases the risk of substance misuse. With the growing availability of substance, both legal and illegal, there is a rising concern about misuse and addiction. While psychedelic research is expanding, it's crucial to balance understanding both their benefits and risks. As we can see here in the graph, clinical trials on psychedelics have increased significantly over the past 2 decades, reflecting the growing interest in their potential therapeutic applications. Now that we've established the scope of the issue, let's examine who is the most vulnerable to drug use. Who does this problem affect? Vulnerable population at risks. Adolescents and young adults are particularly at risk due to factors like peer pressure, trauma, and mental health struggles. Adults experiencing chronic stress, anxiety, or depression may turn into substances as coping mechanisms. Risk factors may include family history, trauma exposure, a limited mental health care access, but however, protective factors like social support, positive activities, and early interventions can help mitigate these risks. Now let's discuss solutions and strategies to address the issue. Early intervention, providing education and support programs early on can significantly reduce drug misuse among adolescents and young adults. Expanding mental health support. Access to mental health resources and counseling is essential in addressing the root causes of substance abuse. Community-based programs initiatives such as peer support and recovery programs play a vital role in prevention and long-term recovery. Also regulating psychedelic use as research continues, regulating psychedelic for therapeutic use while preventing recreational misuse is essential. If we focus on these prevention strategies, expand access to mental health resources, and encourage our community support, we can make a significant impact in reducing drug misuse.
Hello, my name is Elisa Misania, and we're going to be talking about the psychedelic and dissociative drug use as medicines. So firstly, what is the state of the science? A little brief overview. We're going to be talking about the emerging research that we have found that has been exploring LSD, cyclopin, ketamine, and esketamine for treating mental health disorders. And there have been a couple of clinical applications that we have found. Firstly, that esketamine has been approved for treatment-resistant depression in the USA and Europe in 2019. And then cyclopin has been approved for compassionate use in Australia, Canada, and Switzerland. So obviously we're seeing that these clinical applications are being found and treated worldwide. So now we're just looking to have them treated more consistently. And a couple of key challenges we have found have been regulatory hurdles, safety concerns, and risk-benefit assessments. So how do they work, you ask? So they modulate serotonin and glutamine pathways, which affect mood and emotions. And with the diagram on the right, you can see the serotonin and glutamine pathways, multiple and differentiated ways that they are going about. So they're affecting by NMDA, AMDA, AMPA, 5-MPA. There's a lot of different ones, different moods and emotions that it affects. And then obviously it enhances the neuroplasticity, which is the brain rewiring for long-term benefits. And it does have a couple effects on mental health, which is the rapid antidepressant effects, which is on ketamine for depression. And it also reduces the symptoms of PTSD and anxiety. And of course, the study does have limitations. And so its current limitations right now are its small sample sizes and the short follow-up periods that it has. And it is looking for a larger and long-term clinical trials in the future. And so now looking forward to our educational programs. Why does education matter? It's to ensure safe and effective treatment and also reduce the stigma and misinformation that we may perceive without knowledge beforehand. Some of the key training programs that we have found has been MAPS, which is MDMA Assisted Therapy Certification, and then also Johns Hopkins and Imperial College in London does research-backed therapist training. We have also had workshops on psychedelic safety issued by public health initiatives, and of course our community outreach, so online webinars on psychedelic safety and also public health brochures on harm reduction. And so moving on to our current efforts as well, we do have Netflix, TED Talks, documentaries, example, How to Change Your Mind, in order to further educate people on the stigma and misinformation of psychedelics as medicines. And then also university-based psychedelic research centers also provide safe and effective treatment, and as well the stigma and misinformation. And now lastly, here are just a couple of charts and diagrams. On the left, we are looking at a diagram that is talking about the effectiveness of psychedelic substances in treating mental disorders. So this is just a little bar chart comparing the effectiveness of different psychedelic substances. So we have esketamine, ketamine, psychoblin, and LSD. With ketamine rating at the top of effectiveness and LSD rating at the bottom. Ketamine has about an 85 to 90% effectiveness, with LSD having about a 70 to 75% effectiveness, and psychoblin and esketamine in the middle. So you can definitely see which psychedelic substances are more useful in treating mental disorders than others. And on the right, we have a flowchart illustrating how psychedelics affect neurotransmitter systems, so the serotonin and the glutamine systems, and their role in neuroplasticity and mood regulations. So starting from the bottom, we choose whichever psychedelic intake, like the past ones I've mentioned, LSD, psychoblin, ketamine, esketamine, and from that we go up to the serotonin and glutamate modulation into our neural circuit activation, which increases our neuroplasticity, which goes on to increase the mood regulation or decrease, and then the cognitive flexibility as well. And so these are just a couple examples of how psychedelics affect neurotransmitter systems and how also they are effective in treating mental health disorders as well.
Public health significance: transforming mental health with psychedelics. Now, let's talk about why this matters on a larger scale. Mental health disorders affect 1 in 3 people globally, and unfortunately, many of those individuals don't respond well to traditional treatments. That's where psychedelics and dissociative drugs come in. These substances, like ketamine and psilocybin, are showing rapid and remarkable results. For example, ketamine has been shown to reduce suicidal thoughts within hours. From a public health standpoint, this is huge. Policymakers have a real opportunity to drive change by reclassifying certain psychedelics and increasing access through updated regulations. For practitioners, these therapies open up new ways to treat patients with conditions that haven't responded to existing methods. And for the public, this movement can help reduce the stigma around psychedelics and encourage more open conversations about mental health. Of course, there's still a lot we don't know. Some of the biggest questions researchers are working on include: how exactly do psychedelics promote emotional healing and neuroplasticity in the brain? Are they safe long term? What are the risks with repeated use? And what about new methods of administration, like using psychedelics during sleep? Could that be a future breakthrough? Another major concern is equity. Cost and stigma and cultural differences still create barriers for marginalized communities. We need to make sure that these treatments become more available they're accessible to everyone, not just a privileged few. So, where do we go from here? For policymakers, the next step is to push for more research funding and regulatory reform to reclassify these drugs so that they can be safely and legally used in treatment. For healthcare providers, it means adopting evidence-based psychedelic treatments in clinical settings and staying informed on new developments. And for the public, it's about continuing education, reducing stigma, spreading awareness, and advocating for equitable access. Together, we can reshape the future of mental health care and make psychedelic medicine a powerful, inclusive tool for healing.